My patient presents today for a normal exam. She has no medical history, no surgical history. Her vital signs were checked. Blood pressure was 126/76, heart rate of 72, respiration 16, temperature 98.1 degrees Fahrenheit, and SpO2 was 99% on room air. The patient is 5'6", weighs 145 pounds. Before the exam, she was asked to empty her bladder and change into a gown. Her near vision was checked with Rosenbaum chart, and far vision was checked with a Snellen chart. Now, when we first begin, I'll start with inspecting her head and her face, making sure that her eyes are symmetrical, her nose are also symmetrical, looking at her skin, making sure that the color is appropriate for ethnicity and that it's smooth, no lesions noted. Also looking at her head and looking at her hair, making sure that her hair is not brittle, it's not falling out, there are no areas of alopecia. And then I'll go and palpate her skull, making sure that her scalp is freely movable. As I said before, her hair is not brittle and not falling out. I did not palpate any masses, any lesions, and none were also noted. Did you have any pain when I was touching?
No.
Okay. Her head is normal cephalic as well. Then I'm going to palpate her face. Her skin is soft, it's smooth, no lesions, no bruising or any masses noted, and also no swelling. Now I'm going to check her cranial nerves. I'm going to have her do a couple of things. Can you smile for me? Can you wrinkle your forehead? Can you squeeze your eyes tight? Puff your cheeks? And stick out your tongue. Okay. With all the movements completed, she did them well and everything was symmetrical. There was no drooping in her face and there was no deviation on the side of her tongue when asked to stick her tongue out. And now I'm going to look at her eyes. Her eyes, as I said before, are symmetrical. And looking at her conjunctiva, it's pink and moist. Her sclera is white with no signs of jaundice. There's no tearing. Her eyebrows are full. The hair is distributed evenly, as well as with her eyelashes. The eyelashes go outward and curl upward. So no hair loss there. I'm going to check her pupils for roundness, evenness, accommodation, and reaction to light. And now I'm going to do the cover-uncover test. So cover your left eye. And now cover your right eye. Okay. And with the cover-uncover test, there was no nystagmus or strabismus noted. And now I'm going to check for sensation on the face. And so I'm going to touch you in different places on your face, and you let me know if it's dull or sharp. Close your eyes for me.
Dull, sharp, dull, sharp, dull, dull, sharp.
Okay. And so with that, she was able to accurately say which was dull and which was sharp, with no changes on either side, so both sides were even. Now I'm going to move on to her nose. I'm going to check to make sure that there is no perforation in the septum. The nares are patent. She doesn't have any drainage in her nose. And also there are no lesions, any redness, or any bleeding. Can you tilt your head back for me? And the mucosa in the nose is pink, slightly moist. There's no drainage. There were some fine hairs and bilateral nares, which was normal. And now I'm going to move on to her ears. First part is the assessment part, inspection. Inspect both her ears and make sure that they are symmetrical bilaterally. symmetrical for the head, for her head, and that the color is appropriate for ethnicity. There are no masses, lesions, swelling, redness, or drainage. And then I will palpate both of her ears or her auricles, make sure that they're soft and easily movable. And now I'm going to look at her ears with the otoscope. In assessing the ears, I did not notice any redness, any bulging. Um, there were no lesions, no perforations. The ears were pearly gray. There were fine hairs and a small amount of cerumen. So I'm going to check the 6 cardinal fields of gaze. So you're going to look at the tip of my pen and follow it only with your eyes and not with your head. And in assessing the cardinal fields of gaze, there was no lid lag, there was no strabismus, there was no nystagmus noted. And I'm going to move on down to her mouth. First, starting with assessing her lips. Her lips are even. There's slight dark pigmentation, which is appropriate for her ethnicity. There's no peeling, there's no chappedness as well. Can you open your mouth for me? In assessing the inner mouth, I noticed that the wisdom tooth have already been taken out, but all the other teeth are even. All of them are present. They're white. There was no odor in the mouth. The tongue was pink. Mucosal membranes were all pink and moist. There were no lesions noted. Then I'm going to check gag reflex. Say ah. Say ah.
Ah.
And in saying ah, I saw the uvula move up and down, and tonsils are +1 with no swelling, no redness, and no exudate noted. And also with assessing the face, I'm going to assess her sinuses and make sure there's no swelling, there's no edema, there's no pain or fullness. Any pain? Okay. And then I'm going to check her temporomandibular joint and assess for any clicking, any ticking, or any pain. Can you open your mouth for me? And close? Any pain?
No.
Okay. And none of the above were assessed. And now I will perform the Weber test. I'm going to sit this on the top of her head, and she'll let me know if she feels any vibrations. Can you feel the bilateral in it?
Yes.
And now I'm going to hit this again and put it on her, the back of her mastoid bone, and then in front of her ear to check for air and bone conduction.
Now. Now.
And as expected, bone conduction is less than air conduction. So with the bone conduction, it was a smaller amount of time that the sound was heard as opposed to when in front of the ear for the air. And now we're going to move down to her neck, assessing her neck, assessing the color, making sure that it's appropriate for her ethnicity, making sure that there are no masses noted, no lesions, and looking at the front of her neck, make sure that there's no bruising or lesions there as well. Then I'll go over and palpate. Her neck is supple, no masses noted. Then palpate for any lymph nodes. Any pain?
No.
So I'm going to have you do a couple of things. I'm going to have you turn your head from left to right, and then up and forward and backwards. And then I'm going to have you shrug your shoulders. Okay. So she was able to follow all directions with no complaints and no restrictions and movements, and then able to shrug her shoulders even with resistance placed on her shoulder. And also with palpating the neck, then I'm going to have her swallow. And so I can feel for rising and fall of the thyroid. And it's also midline. There's no deviation even when she swallows. And I'm going to listen to her carotid arteries. First palpating individually. Now I'll auscultate. Okay. And now we will move on to her upper extremities, assessing both of her arms for color, for smoothness, for any birthmarks, for any lesions, any signs of trauma, and none are assessed. Also looking at her nail beds, making sure that there is no clubbing of the nail beds, there's no discoloration, the nails are not brittle, the nails are not falling off, and all of them are intact. You put your palms out. There are no lesions, no rashes on her palms as well. And also color is appropriate for ethnicity and even throughout. I'm going to palpate her arms. No masses noted as well on the arms. And now I'm going to palpate the lymph nodes. Starting with the preauricular, postauricular, occipital, submandibular, submental, and moving our way down. So palpating the chest, and then over to the, move on to the side for me, axillary lymph nodes. And with that, I was just assessing, making sure that the lymph nodes that were palpated were soft and easily movable and not fixed, hard, or painful, or had any heat on them. And now I'll assess her radial and brachial pulses. Radial and brachial pulses are +2 bilaterally and not throbbing. And capillary refill is less than 2 seconds. Can you turn to the side for me? So now I'll be assessing her back and posterior chest. So I'm checking for color, for uniformity, for any lesions, any signs of trauma, and any kyphosis, lordosis, or scoliosis in the curvature of the back. None assessed. Now I'll palpate. And skin is soft and even throughout. You can sit back forward. And now I'm going to assess the chest and assess the same thing as the back with colored uniformity, the depth of respirations, making sure that her respirations are even, making sure that she's not having any difficulty breathing, that there's even chest expansion when taking deep breaths. She doesn't have any barrel chest, the color is even, She has no masses or no signs of trauma noted. Now I'm going to auscultate her lungs, both anteriorly and posteriorly. Deep breath in and out. Lung sounds are clear bilaterally and throughout, with no crackles, rhonchi, or wheezing noted, and respirations were regular, easy, and even. And in palpating the chest wall, I'll also palpate the pericardium, noting for any pulsations or thrills, and then the apical pulse. And then I'm going to check for any tactile fremitus. Every time I put my hands down, say 99.
99, 99, 99, 99, 99.
And with that, I was just checking for any increase or decrease of vibrations. And now I'm going to percuss and assess for any hyper or hyporesonance. And now I'm going to listen to her heart sounds. Starting with the aortic, the pulmonic, Erb's point, tricuspid, and mitral. And now, as I've done for the front, I'm going to check for tactile fremitus and percuss the back as well. All right, I'm going to percuss. When I place my hands down, say 99.
99, 99, 99, 99, 99.
Okay. Then I'm going to put my hands on her back just like this and have her take a deep breath. Take a deep breath. There was symmetric movement in the back when she took her deep breath in and out. Now we're going to move on to the abdomen. I'm going to inspect the abdomen, check for any movements, any change of color, any contour changes, or any extra movements, scarring, bruising, masses that are normally not there. Then I'm also going to use my pen light to look. And now I'm going to listen for bowel sounds. If no bowel sounds are heard, I'll listen in the same area for 2 minutes and make sure that I don't hear anything. Bowel cells are active in all 4 quadrants with no extra noises besides the normal gurgling sounds. And now I'm going to percuss, then do light palpation, and then deep palpation. I'm going to do light palpation. Now deep palpation. Did you have any pain? No pain assessed, and there were no masses or loops noted. And now we're going to move on to her legs. I'm going to inspect her legs, check for color, for uniformity, for hair distribution as well. Okay. She has no hair on her legs. The color is distributed evenly. There is no masses, there's no bruising, and there's also no moles or birthmarks noted. And you see that she's keeping her legs up pretty straight. She's able to have good strength. And I'm going to palpate her legs. The skin is smooth. And now I'm going to palpate for her pulses. Pedal pulse. Post-tibial pulses. And the popliteal pulses. Then I'm going to check for the reflexes. Okay. Okay. Reflexes in the legs are okay, and then I'll check for the Achilles tendon reflex. Those reflexes are intact as well. Now I'm going to have her stand up. And then turn to the side. Then I'm going to have her bend over and stand straight up. And with that, I was just assessing her back and the curvature of her spine, checking for any scoliosis, lordosis, or kyphosis, and none of them present. And that concludes my exam.